Sorry, mate. Lovely. All good? Lovely. You don't want to get, you're not going to stay in the sun, Martin? You sure? Okay. Lovely. Morning. I'll just read off the, first go through COVID, then I'll go through the announcements, then I will pass over to Margarita, Martin and Matthew to talk about their experiences. They've got all expertise in their particular fields in the disability sector, so I'll ask them to comment. And then Professor Ben Cowie will talk, and I'm happy to take questions. So there were 1,638 new cases yesterday, all locally acquired. Almost a quarter of those are for people aged in their 20s. We currently have 15,074 active cases. Sadly, 2 people lost their lives with COVID-19. A woman in her 60s from Wyndham, and a woman in her 70s from Hume. I pass on my deepest condolences to their family and friends at such a difficult time. 564 people are currently in hospital with COVID-19. 115 are in ICU and 74 are on ventilators. Of the people in hospital yesterday, 66% were unvaccinated, 27% were partially vaccinated, and 7% were fully vaccinated. These numbers continue to show the power of vaccinations in keeping the vast majority of people out of hospital, and especially out of ICU, most importantly. There were tests and vaccines yesterday. 77,238 tests were processed yesterday. That's a record by more than 6,000 tests, and I want to thank everybody who came out yesterday to take up that test. Thank you. 36,672 vaccines were administered out of our state hubs yesterday, and many more thousands were administered by GPs and community pharmacies. 84.4% of people over 16 years of age have now received their first dose in Victoria, and 55% have received their second dose. Between state clinics, GPs and pharmacies, there is every likelihood you can book a first dose for your appointment tomorrow. So if you haven't had your first dose, please go and do it for the benefit of everybody in our community. So today we're announcing a $5 million boost to vaccination rates amongst people living with a disability. We're launching 10 dedicated disability pop-ups in areas of concern and expanding our successful disability liaison service by 16 extra officers. This builds on a wide range of existing help available to help people living with a disability and their loved ones and carers, of course, to come forward and protect themselves, their family and their community. As of the 30th of September, more than 71% of Victorian NDIS participants aged 16 and over had received their first dose of the COVID-19 vaccine, compared to 67% the national average. So we're doing slightly better, but it's simply not good enough. Of the NDS participants in Victoria living in disability residential accommodation, more than 81% had received their first dose at least. But vaccination rates of Victorians living with a disability are still lower than the general population, as I indicated a minute ago, at 84.4%. We've got to keep pushing through. That's why from 8th of October, all of Victoria's state-run vaccination centres will support people with disabilities to get vaccinated any time without a booking. 10 dedicated disability vaccine pop-up centres will be launched through the month of October, established in local government areas of concern and delivered in conjunction with key organisations. So that'll be those where we see hotspots, there we see low vaccination rates. We're going to go out, we need to keep pushing, harassing and just non-stop getting this vaccination rate up for our community living with disabilities. It's just not acceptable where it is at the moment. We can't open up when we've got people living with disabilities, with vulnerabilities, if they're not at a higher rate of vaccinations, and that's what we're pushing to do today. These build the 10 dedicated disability vaccination pop-up centres. They build on the priority access already available across many vaccination centres with enhanced accessibility and pop-ups, disability-friendly drive-through clinics and a dedicated new low-sensory site at La Trobe University. This is on top of the 2 disability worker vaccination blitzes we've had over the last couple of months. In addition, Victoria will establish hearing, autism and other disability partners as vaccine ambassadors to promote the uptake and provide case management. Victoria's disability liaison officers, which I was mentioning a minute ago in relation to expanding their services and numbers who are doing it, have already assisted over 6,000 people to be vaccinated. They're very much about ensuring that they can provide options for people with living with disabilities about the many options which are available for them to get vaccinated. So that can potentially be something like InReach, but then it's also about identifying those centres with accessibility, whether it be the Royal Exhibition Centre in terms of disability access for people with wheelchairs and alike, or whether it be, say for argument's sake, in Bendigo and Ballarat, where we've got other enhanced centres to ensure that we can ensure everybody has the opportunity to get vaccinated. So, as I was saying, the program is being expanded by 16 officers, so if people want to get in touch with these officers, they're embedded in the health department, you ring 1800 675 398 or go onto the coronavirus website to actually seek details from there and you will be put through. I think now I will hand over to Margarita, who is an incredibly articulate advocate for the disability sector and for the coal community. So I will be quiet for once and let Margarita talk.
Thank you, Minister. Good morning, everyone. When COVID hit last year, it was my worst nightmare. Living alone in affordable housing, worrying that, it's been 61 plus. My greatest fear of somebody or my loved ones, as in my friends, finding me dying to COVID. And what that did was it raised my anxiety around not having a will. So I actually committed to doing a will for the first time in my life, which scared the daylights out of me. And it was very daunting. But also the fact that I had to get over my phobia of needles, because I knew that too dark, so when it was going to be brought in this year. So came this year when the vaccines were available, when the Minister announced, I think it was the last time, or the first time, around the bliss for disability workers, I saw that as an opportunity to make a mark and strategise ways to actually get myself to one of the state hubs. I took off in my motorised scooter, and from the moment I arrived at Jeff Shed, the people knew that my anxiety was really high, and what they did was took me through quickly and then actually made sure that I had 2 nurses with me and were with me through the whole experience. Once I'd done one, the next one was easy. But after doing it, I was so relieved that I was now in a better position to live a longer life and not worrying about being found dead in my apartment. And being safe in where I could visit my loved ones and my friends and still advocate, in the work that I do. But more importantly, I just want to highly recommend everybody go out, get the jab. Once you do it, the sense of relief, the sense of feeling safe it's a feeling that I don't think I've ever felt for such a long time. And so I'm really emotional because it was the most scariest 18 months of my life. And I hope I don't have to go through that again. That's all for me. Thank you.
I'll ask Martin to say a few words. Martin's a former travel writer who was unfortunately involved in a car accident some years ago, but writes like an angel, and he's happy to say a few words today. Thank you. Can I move that up?
That's okay.
Oh, sorry.
Thank you very much.
That's all right, mate. Sorry.
Good morning.
Okay, so shut up, leave it alone. Okay.
Thank you. Good morning, everyone. I'd just like to say, personally speaking, I think it's everybody's social and moral obligation to get vaccinated, and not just against coronavirus, Vaccination works, and vaccination has allowed us to eradicate some really horrible diseases in the world. And the thing is that as a person with disability, I'm much more likely to be mixing with other people with disability who are also in a high-risk group. I was left a quadriplegic 10 years ago, 11 years ago when I had an accident. So I was already in a high-risk group, and I was already getting a free flu shot because I'm in a high-risk group. So as soon as 1B opened, I was down there at my GP. I was lucky to get it with my GP. It's very easy, so I've been double vaccinated for quite some time now. But as I say, I think it's even more important for people with disability to get vaccinated because we're much more likely to be in contact with other people with disability. Even during COVID, I was in a number of projects where I was in face-to-face projects with other wheelchair users. I'm also reliant on professional support workers who come in morning and evening. And these support workers have lots of other clients, many of whom are also in a high-risk category. Now, I would find it very irresponsible of me not to get vaccinated. I would hate to think, I would be devastated to think that I was part of a transmission chain that led to somebody else who was in a high-risk category either being hospitalized or even worse, dying. I could never live with myself if that was the case. And that was just irresponsible behavior because of a bad choice on my behalf. So I think everybody has a real moral duty, and particularly people with disability have an imperative to get vaccinated. As Luke said, I worked for the Lonely Planet for 20 years. I love traveling. And there's no way we're going to be traveling again until we get vaccination rates high enough. I traveled a lot. I traveled 3 or 4 times a year. Now I'm just waiting for Queensland to open so I can get up to Cairns and get some warm weather. It's not going to happen until we get vaccination rates high enough. We're not going to be able to open up to the rest of the world. We're not going to be able to get our Australian citizens home again. There are dozens of reasons to get vaccinated, dozens. And there's only one good reason not to get vaccinated, and that is if you have a valid medical reason not to. So that's really all I've got to say.
Thank you very much.
Thank you very much.
You. And last of all, we'll have Matthew, who's a former CEO of a disability advocacy group, has worked in the sector for many, many years and has some personal experience he wants to share with you.
Good morning. I think that it's extremely important that we all get vaccinated. I'm a member of the disability community. I've worked with people with disability for almost 30 years. Being vaccinated has been a part of my work practices. It's been a part of my life for those 30 years. I have been vaccinated against hepatitis A because I've worked with people with disability who are in prisons, who live in boarding houses, in other institutions where hepatitis is easily transmitted. I've also been vaccinated against the flu every year because I don't want to place the people I work with at risk. I don't want to place my colleagues at risk, and I also don't want to be at risk myself. So I take it as a part of my social responsibility to get vaccinated, to keep myself safe, to keep the people around me safe. And this is something that I urge everybody to do. The vaccination is available in Victoria. It's really important that we access it. COVID is a very real thing. At the moment, I've got my brother, my sister-in-law, my niece and nephew with COVID. They're all isolating. This is very real. It is going to sort of come into our lives if it hasn't done already. We need to make sure that we have every level of protection that's available to us, and the best way of doing that is by us having the vaccine.
Thank you, Matthew. Thank you very much. And just Professor Ben Cowie.
Thank you, Minister, and thank you, Margarita, Matthew and Martin, for those fantastic perspectives and for your ongoing guidance in this area. It's so important, so thank you. So I'm going to talk initially about the geography of the cases in the last 24 hours that have been reported. So yesterday in the northern suburbs, we saw 566 new cases, which was just over 1/3 of all of the cases that were reported yesterday. The northern suburbs do continue to have the highest number of active cases, with more than 6,500 cases, or just over 43% of all of the active cases in Victoria currently. In the West, we saw 485 new cases, which was 30% of the total for yesterday. In the Southeast, there were 351 new cases, and in the East, there were 114 new cases. Turning to regional Victoria, there were 115 new cases, which is 7% of the total new cases reported yesterday. This means that there are now 707 active cases outside of Melbourne. But on a positive note, the majority of these have been linked to existing cases. In terms of some of the larger outbreaks that we're responding to currently, there were 11 new cases in Greater Shepparton, 8 unknown contacts, and we're investigating the source of a further 3. There were 8 new cases in Ballarat, again, all linked to known cases. 16 new cases in Geelong, and again, mostly linked to known cases and investigations ongoing. 17 new cases in the Mitchell Shire, 14 of which have known contacts, and 3 still under investigation. And of note, 11 new cases in the Mount Alexander Shire. The acquisition source of these cases is currently unknown, but investigations are underway, and they're spread across 2 households. There were 4 new cases reported in Mildura, all within the same household. And turning to Gippsland, there were 15 new cases in Latrobe, with the majority linked to the existing known cases in the local outbreak. And there are 11 new cases in Baw Baw, with more work underway to link the cases that have been reported in this area. So turning to some of the industries of concern, in just over a week, we've had 10 abattoirs or meatworks with transmission on site or that have been identified as exposure sites. And there are more than 30 confirmed active cases that are associated with these sites. Clearly, a significant amount of work has been underway over the past 12 months and beyond to improve COVID-safe practices, to work with industry and with unions, and to improve the vaccination rates in this industry. And this has made a really dramatic difference to the scale of these outbreaks compared to what we saw last year. We're certainly finding that the vaccination status of contacts is in some regards very high, and this is a fundamental protection for those workers and for their families and for the whole community. And we really do want to thank everybody for partnering us in that with us and leading much of that work. So extending to further areas of vaccination discussion, further to the announcements made by the Minister just now. So for schools, we have 4 new school pop-up sites opening this weekend, in addition to the sites that were previously announced last week. So these new sites are Fair Hills High School in Knoxfield, Hume Anglican Grammar in Mickleham, Keilor Downs Secondary College, and a joint pop-up between Mount Rowan Secondary College and Ewell Park Community College on Forest Street in Wendouree. So these are in addition to the Minaret College in Officer, Brunswick Secondary College, Kernai College in Morwell, Northern Bay College in Corio, and Werribee Secondary College. So these school pop-ups are open to anyone in the local area, whether they're members of the school community or not, this coming weekend. They are all providing both Pfizer and AstraZeneca vaccines. Some are taking bookings, but all will accept walk-ups for people who don't have an appointment. And it's a great opportunity for locals in those neighbourhood areas and those local areas to join the millions of Victorians who have already been vaccinated. So thinking about the vaccination rates and really focusing on the importance of these vaccines, in the 7 days from Tuesday last week to Tuesday this week, we've had about 10,000 cases of COVID-19. Of these cases, 7% were fully vaccinated, 15% were partially vaccinated, and 79% were unvaccinated, no doses of vaccine. And this is unfortunate because it's despite the fact 87% of the cases were eligible for vaccination at the time that they were diagnosed with COVID-19. Just this week, at these press conferences, we've heard from intensive care unit nurses caring for patients who were pleading for vaccination as their situation tragically deteriorated. We've heard from COVID survivors who caught the virus before vaccines became available and who profoundly wished that they could have avoided the illness and the often neglected or unseen long-term consequences of COVID-19. And in the data I've just given you, we have the hard underlying facts that shows how much more likely you are to get COVID, to pass it on to your friends and family, and most importantly perhaps, to end up in intensive care or tragically to lead to further loss of life if you choose not to get the vaccine. And so at that point I might hand back to Minister Donnellan to take any questions. Thank you.
Thank you. Questions?
On this disability announcement,
Whatever you like, yeah.
This would seem like something that a year and a half ago was something that was the federal government's responsibility. Is this a case of people falling through the cracks?
Look, it is a Commonwealth responsibility in terms of NDIS participants and in terms of the residential, those in residence and those working in the residential services. So this is very much about us stepping in. We're not happy with the vaccine rates at the moment. We're not going to be, we're opening up. We need to deal with this now, and that's why we've stepped in.
On residential care, what work's being done to change furlough requirements in that area? We've heard lots about supermarkets and GPs having to furlough because of positive cases. Is stuff being done with fully vaccinated and staff on PPE?
That's right. What we set up was actually the Victorian Disability Response Centre specifically to bring the Commonwealth and the states together to deal with those issues specifically in terms of furloughing, in terms of workforce and the like, because very much that is a Commonwealth program in terms of the National Disability Insurance Scheme. But we're in there helping to ensure that we actually have, whether it be public health outreach services and the like, to actually do those vaccinations, to actually undertake those arrangements. So I think the Commonwealth, from memory, is contracted Aspen to actually provide surge workforce in those instances and the like, and that's what they'll do. But it is very much about working together to ensuring that we can assist them in terms of getting those vax rates up to where we need them presently.
Is there a plan though, in supermarkets they've changed the rules of who needs to isolate after a positive case? Is there a thought of changing the rules for those working in residential care so they don't have to do 2 weeks?
That will be worked through in terms of what's in terms of the circumstances we have, in terms of the spread, the community spread of COVID and the like. But there is arrangements presently in terms of surge workforce and so forth to assist in those matters, and that's very much why after the initial outbreak of COVID earlier on, we set up we requested the Commonwealth come in and work with us as a combined team in the Victorian Disability Response Centre so that we could coordinate our responses, we could assist the Commonwealth in those endeavours and ensure that we push those vax rates up as quickly as we could.
If I ask Ben? You go. I was just going to ask Ben a question. Oh, Ben, do you mind if we just ask you a quick question? We put it to the Premier about Sweden's decision on Moderna for under 18s, but we thought we'd ask you as somebody with a bit more vaccine knowledge. What do you make of their decision?
Sure. So obviously the TGA and ATAGI will be working through the implications of any decisions by similar countries and similar regulatory authorities in this regard. I note that the data underlying these decisions, well, certainly to my knowledge, have not yet been published, so it's a bit premature to draw a conclusion on those decisions. What I would say is that certainly from the United States experience, to my knowledge, there was no increase relative to, for instance, the Pfizer vaccine in these side effects in the American experience that's been reported to date. We can check, or I will have to check to make sure that that is still the case. What I would say that is fundamentally, these side effects are incredibly rare. If we're looking at the incidence of myocarditis or inflammation around the heart, most of which is actually quite mild and settles within days with simple management, the incidence of that was something like 1 in 30,000. And it's much more likely to actually get that side effect if you get COVID-19. It's much more likely to get that side effect from the actual infection. So again, I think we're facing this question. It'll be great to see those data. No doubt the TGA and ATAGI will be exploring that very thoroughly. These are safe vaccines. They're incredibly effective vaccines. We've been through the data of what they're doing in terms of saving Victorians from ending up in intensive care and from losing their lives. Those data are right now and right in front of us, and they're incontrovertible. So we will obviously be looking at all of those analyses when they become available, working with our national colleagues, but these are safe and effective vaccines, and not only are they the way to stop unnecessary loss of life and serious illness, they're also the way that we're all going to get our freedoms back. It's really important.
On Twitter last night, the Cho was actually pushing Moderna, saying that it may well be ahead of the pack because of its longer-term immunity. That's the case, and should that be the preference for people for that reason?
So, look, these vaccines, and thinking, if we're looking at the mRNA vaccines particularly, so Moderna and Pfizer, these are available right now in a way they've never been before. Our community pharmacies, particularly with Moderna, are doing an amazing job, and I think they've been very popular for that reason, to actually improve access to people who previously struggled to get access to vaccine. They've all got their slight differences. That's the case with any therapy or medical product. Essentially, the one thing that unites the three vaccines is, to me, the most important fact, and that is all of them result in a 90% reduction in ending up in hospital, ending up in intensive care, or losing your life. That's the point of similarity between them, and that is by far and away the most fundamental fact.
But should Moderna be a preference, do you think, because of its longer-term immunity, if that's the case?
So again, I think the issue with long-term immunity, it's an important one. We are all going to get boosters available in the coming months, into next year. That's going to be the case for all of us, irrespective of whether we get AstraZeneca or Pfizer or Moderna vaccine. I'm less concerned about long-term immunity than I am about immediate access to immunity, because this is what we're facing right now. We're facing the highest case numbers we've ever done in Victoria. We're facing increasing numbers of people ending up in hospital. So honestly, if we're sort of talking about the relative risks and benefits of vaccines, the fundamental benefit is getting one right now today and not ending up in hospital and moving us down the roadmap towards freedom.
You mentioned new cases in the Latrobe Valley. A local primary school there has had to shut. The area only just came back out of lockdown. Do you think it may need to go back into lockdown?
The question about how we respond, obviously to schools and cases in schools, but also more broadly to increases in cases in local areas, I think it's fair to say that's going to have to increasingly become nuanced. We are all moving down that roadmap, which is defined by our underlying vaccination status in the community. So the way that we can make lockdowns less and less likely and ultimately unnecessary is by continuing that journey Victorians are doing so amazingly and getting vaccinated. In terms of the specific answer for a given region, whether it's Latrobe or elsewhere, I think if there's concerns about the nature of the cases, if the health services are particularly impacted, certainly if significant school exposures occur, that all goes into the decision making around whether a local government area meets the criteria for going into lockdown. But I do think, and this is part of us opening up and getting back some of those activities that we've all missed so much, and kids going back to school is a really good one, that will come with increased cases. There is no way around that. We will see increased cases. It's why the Department of Health, along with our colleagues in the Department of Education and Training and with schools, have established, again, sort of contact tracing approaches, which again are more nuanced and look at the individual characteristics. So as time goes by, we will see much more individual classes or individual students being required to quarantine, as opposed to whole schools closing down. But that still needs to be on the table if we do see significant transmission occurring.
Are you worried about the Latrobe Valley? Is it an area that is of concern, or is it about the same as all the other regions at the moment?
Well, I think it's fair to say, and as I said at the start when I was going through the numbers, that we're seeing increasing case numbers in many parts of the regions. Latrobe was of particular concern, and that's why Latrobe went into lockdown. I think that buys time. It is a circuit breaker. It's allowing the health service, the local public health unit, and all of those responding to have a bit of time to get their responses in order. But sort of extended lockdowns in regional areas, as is the case for metropolitan Melbourne going forward, are going to have to become increasingly rare. And the way we bring that forward and do it safely is to get as many people vaccinated as we possibly can right now.
How concerned are you about the Children's Hospital cancer ward exposure, and are you aware of if any patients have tested positive today?
Yeah, I'm not aware of any patients testing positive today. So, look, any outbreak in a healthcare facility is something that's of concern, obviously. Again, the department and particularly all of our health services has done a huge amount of work to both manage the risk as far as possible, but in the same way that I was just discussing with schools, to again have a more nuanced approach to identifying contacts and cases to try and avoid the sort of health system impacts and particularly the workforce impacts we saw, particularly during the second wave last year. So look, any outbreak at a healthcare facility is of concern. Come back to the point that what we can do as a population to protect our health services as much as possible is to get vaccinated, because then there's a much less likelihood of those cases being introduced into the health system.
Are you anticipating a sort of similar situation that we saw at the Royal Melbourne Hospital, where because you've got a larger percentage of the Royal Children's Hospital staff vaccinated, that we won't necessarily see that spread? What is the contact tracing telling you?
Yeah, no, absolutely. I think that is absolutely true, and that's on two levels, really. Firstly, vaccination obviously protects staff on top of all of the other protections that we've put in place, personal protective equipment and bubbles and all of the other mitigations. So vaccination is an incredibly welcome addition to all of that. The second point is, if a vaccinated person does become infected, their infectiousness to others is reduced if they've been vaccinated. So you also see less secondary cases, and that's been shown certainly earlier on in the year. And we certainly anticipate that is also the case with the Delta virus. So the vaccination mitigates not just the risk to the individual of them getting infected, but sort of similar to wearing a mask. You're less infectious to others if you, unbeknownst to you, have COVID-19 and you're wearing a mask, or if you've been vaccinated.
Do you know what those updated statistics are? In terms of if you're fully vaccinated, how much less likely are you to pass on the virus or even contract it yourself in the similar situation?
Yeah, so the earlier statistics were around 50% reduction amongst household contacts of people who were vaccinated if those healthcare workers had breakthrough infection. It is likely that may have reduced somewhat with Delta. I think there's still more data to come in on that. I think it would certainly be the case that the infectiousness is reduced. It might be by a lesser margin, but there's more data that's needed to really be able to be categorical about that.
Do we have any indication when Shepparton might come out of lockdown?
I beg your pardon?
Do we have any indication when Shepparton might come out of lockdown?
So again, sort of similar to what we were discussing, so Shepparton and Moorabool Shire both were put into lockdown last Friday, and that was for 7 days. So really in the next 24 hours we'll be reviewing again all of the features, not just case numbers, but the connections of those cases to others. We'll obviously be consulting with our local public health unit colleagues there who have the on-the-ground intelligence and experience of what's happening, and obviously health services. So that decision hasn't been made. We'll be reviewing all of that in the next 24 hours and obviously giving an announcement either way tomorrow.
Rapid.
Can I ask you about the vaccine mandate?
Yes.
The head of the Meat Workers Union today said that once it comes in next Friday, he's worried he's going to lose 10 to 20% of the workforce. 2 questions on it. His suggestion was that to use rapid tests every day rather than getting vaccinated. Is that any kind of realistic alternative to a mandate?
So, look, I mean, I'd welcome any sort of opinions and input into this question. Firstly, I'd say that Meatworks and meat workers have put a lot of effort into making their work sites as safe as possible already. There already is surveillance in place. I understand that Meatworks already have sewage surveillance in place, and that if there's a positive wastewater detect at the facility, then PCR testing, so conventional COVID testing as surveillance for the workforce on site is initiated at that point. So we have existing surveillance using a diagnostic test, PCR, and also wastewater surveillance. Rapid antigen testing may well become a significant contribution, particularly to repeated testing and that sort of surveillance mechanism in a range of industries going forward. My opinion is it is absolutely not a replacement for vaccination, because whilst being tested allows early detection, in no way does it prevent you from getting sick. In no way does it mean that you will not transmit virus to your family or to your co-workers. So I think surveillance testing, whether it's wastewater, whether it's PCR testing, whether it's rapid antigen testing, definitely has a place, but in no way does it replace vaccination, which is actually stopping you getting infected, not just detecting it early.
And that Meat Workers Union says particularly smaller operators could suffer. Like if you take out 10 or 20% of 30 people, it's a bigger hit. And the Farmers Federation have been the other big kind of union that have said it could have a big impact on them. If you've got 5 farmers in a really remote area, you could lose 2 or 3 of them all of a sudden. Is there any kind of flexibility that the government's looking at in discussions with these industries, with one, say, for example, in farming where you're more remote, perhaps less chance, less cases in the area, that they might get an extension or some kind of flexibility on the mandate?
So, in summary, no. I think I'm obviously sensitive to the circumstances of individuals and the impact, the negative impact that a mandate has, as well as the profound positive impact that we're seeking to achieve through it. I would just come back to the point that there are many, many Victorians, many Australians who have lost their jobs over the course of this pandemic. There are many Victorians who are not able to work currently because of the lockdowns that we're in and because of the amount of COVID activity that we've got in the community. The point of the mandate is to say, for people who are permitted to be working during lockdown and are out and about and in contact with other people through the lockdown, by the very nature of their permitted work, those individuals will be required to be vaccinated to protect themselves, to protect those people they're coming into contact with, and indeed the whole community. And look, it does have negative consequence. It absolutely does. I'm not pretending it doesn't. But the positive outcome of this is protecting us, protecting our health system, and getting the rest of Victorian industry open that much faster.
That mandate will stick around longer than the lockdown, though.
Yes, but if you look at the roadmap, certainly people are still meant to be working from home, even in the next phase of the roadmap. And then I think further down the roadmap, there's discussion of people who are fully vaccinated being able to work on site, whilst others are still working at home. So it is still the case that many other people will be needed to be vaccinated if they're choosing to work on site, and that's under the roadmap.
Does that mean that when we open up for the fully vaccinated, that places like retail, hospitality and beauty, the people working on site there would have to be fully vaccinated as well, like their patrons?
So that's on the roadmap. It does point out that for people to be, there is differential settings for on-site work, so that going forward, as we are trying to free up the economy and free up all of those activities that we all miss so much, that we do that as safely as possible. And yes, absolutely, it's expressly written into the roadmap that there will be a point where people are permitted to work on site, but that will be restricted to people who have been vaccinated.
The rapid antigen testing that's coming for healthcare that was announced yesterday, in part for hospitals, do you think it should be broadened to be for visitors to hospitals?
So There's a lot of questions. Look, it's a really good point, and discussions are ongoing, certainly at the national level about that as well. It opens up broader questions of things like visitors to aged care facilities and their testing, healthcare. So basically any sensitive setting. Certainly at this point in time, for instance, volunteers are in scope. So when we're looking at the permitted worker list, volunteers that are working in those permitted sites are in scope for the vaccine mandate. It's somewhat of a different step to take to say someone whose employment requires them to be vaccinated to someone visiting a relative as a requirement to be vaccinated. So I think there are differing opinions on this. We certainly haven't moved to that at this point in time. That's for vaccination, obviously. Yes. For testing, again, there's surveillance for the highest risk staff. We haven't gone there for testing for visitors. Well, I think, again, there's a bit of a difference between someone whose employment requires them to be on site and delivering care versus someone visiting a loved one in hospital. And there is a difference. That said, I do note, and to the core of your question, several of the aged care facility outbreaks that we're managing at the moment, we believe that the incursion was a visitor, that the incursion into that community was a visitor, and that's largely because of the really high vaccination rates of staff and all of the other settings. So no, it hasn't been required. I think rapid antigen testing might provide an opportunity to better operationalise that because you do get the results so quickly, but it's not been considered in terms of a requirement at this point in time.
And why is that? Given the potential benefits, why is it not on the table or simply happening?
Well, the rapid antigen tests are only just being purchased, and the national sort of approach to the use of rapid antigen tests and the authorisation from the TGA is only from the 1st of November for their sale. So, I mean, the discussions are ongoing, but I honestly, my personal opinion, I think rapid antigen tests will provide a significant additional control that we can deploy. They do have less performance characteristics than conventional testing. They're not as sensitive and they're not as specific, but you can turn them around really quick. And so it is certainly an advantage. And I think we'll see increasing use of them. Exactly how that goes in terms of recommendations versus requirements is yet to be determined.
Sorry, you go.
I was just going to say, just on the hospitalisations today, in ICU numbers, ventilators today, it seems like there's a spike in that number. Are those numbers higher than previous days, even though we've been in the same ballpark for our daily case numbers? Those numbers seem to be up.
Yeah, and yes, they are, and they will continue to go up. I mean, tragically, as we see cases go up, what we will see the week to 10 days after that is hospitalisations go up. You know, when someone's diagnosed, when they first get symptomatic with COVID, the real danger period is after 7 days after their symptoms onset, particularly in the second week. So yes, we will see that. And when we see days of 1,700 cases, we're not just worried about that because of a case number that is concerning. The real worry about that is that that's 80 or 90 people who are going to end up in hospital down the track, and the same the next day, and the same the next day, and the same the next day. And so, yes, as Minister Foley has said here, as Jerome has said, as the Premier has said, and as Brett has said, hospital pressure, the pressure on our health system is increasing and it will continue to increase. And the thing we can do about that is get vaccinated.
So today's spike is directly correlated to essentially the grand final super spreader couple of days that we had last week.
So if you go forward from a point of time when you're infected, the most likely time you end up in hospital, having had illness for a few days, enduring it at home, being looked after at home, but then deteriorating, will generally be in the second week of infection. So that's exactly where we are now.
Given all that, are you still confident that we're on track to hit our roadmap targets, or are you concerned that they might need to be delayed?
So I think the roadmap targets we're certainly on track to achieve in terms of the vaccination of the whole community. Victorians have come forward to be vaccinated at internationally leading levels. I mean, our first dose coverage now of people aged 12 and above at 83% is right up there with the top jurisdictions internationally. So we've got to see those doses flow through to the second doses, obviously, but we've also got to make sure, and I think the core of Minister Donnellan's announcement today is making sure that people who, for whatever reason, have had less access to vaccination, we can't leave anybody behind. And that's the core of what Minister Donnellan has announced today. It's the core of the neighbourhood vaccination effort that I think Deputy Secretary Bromley and others have spoken about at these press conferences, to really look at areas where those numbers are lower than the state average and do every last thing we can to provide vaccine to those areas, because we will only see numbers turn around when the vulnerable communities who are currently overly represented in our cases and our hospitalisations, when they're vaccinated to sort of same levels everybody else is.
Would you be comfortable opening up if we still see these case numbers?
So the roadmap targets are really obviously around vaccination uptake. If we can get vaccine levels up to the state average everywhere that we're really focusing on at the moment, then I think we will definitely see a response to that in terms of the case numbers. We will. Because vaccination stops cases, it stops hospitalisation, and it stops deaths. So for every Victorian who goes out and makes their booking today, gets vaccinated today, that is their part in ensuring that we can move down the roadmap safely and protect our health system as we do so.
The new New South Wales Premier has today unveiled more freedoms for its citizens once they meet those targets. Is there any scope to do that here in Victoria?
Sorry, there was something about freedoms for...
Yeah, in New South Wales, the new Premier has announced more freedoms once they hit those targets. Is there any scope to do that here?
Oh, look, I think, obviously that's a matter for the whole Victorian government. From my perspective, there are such tantalising freedoms already in the roadmap that I can't wait to spend time with friends and family more, and that's all very much in the roadmap, and that's what I'm gunning for. So I think if we all do that, I certainly don't have anything to suggest or announce today, and it wouldn't be for me to do that. But our advice to the Victorian government would be that, our first priority is making sure that we can continue down the roadmap in a safe fashion, do everything we can to get vaccination efforts up, and then beyond that, it's really a matter for the government.
How is the speed of our first dose uptake tracking? Has it slowed in recent days or over the last week as we get past that 80%?
I honestly don't know the answer to that. It'll be good we'll definitely come back to you with that. That's not my understanding, and I think it may have slowed in some areas with very high vaccine uptake already, but in other areas where the uptake has been less, it's been increasing actually in rate, which is exactly what we want to see. So I think those both influences might be evening out, honestly, would be my best estimate of the answer to your question. The key is getting those areas with lower vaccination levels up to the same level, and there's a huge amount of investment going into that right now by health services, GPs, pharmacies across the board. So no, I don't think it is slackening off. It may be in some areas, but that might be because we've hit already those higher levels.
And in terms of the second dose rate getting up towards that 70, have you had any more updated projections on when we'll get to that level? Is there any chance we'll get to it before October 26?
Oh, I think there's a definite chance we could get there, but that's up to everybody out there, really, to go and get their first dose and get their second dose. 3 weeks spacing for Pfizer, 4 weeks spacing for AstraZeneca, 6 weeks spacing for AstraZeneca, 4 weeks for Moderna. For people who have had their first dose, if they've got a Pfizer appointment that was booked 6 weeks down the track, please bring that forward. Get it done at 3 weeks. It'll protect you, and it gets us all towards those targets. But the most important part of those targets is that a doubly vaccinated person is much less likely to get Delta infection, much less likely to end up in hospital. So that's the core of why people should get their second dose. But getting us to the targets means we do free up that bit more safely.
Just looking forward, do you support crowds at the Melbourne Cup, and how many people would you be comfortable?
Was that question about the Melbourne Cup?
Yeah, do you support crowds?
Look, there's a whole public health offence framework. I've certainly got nothing to add to that today. There's a whole framework by which these events are assessed. Vaccination levels is one of those, both in the community, a whole lot of safety measures, as happened with major events last year. So I've certainly got nothing to add to that today. But again, the best way we can make these things safe is by getting the numbers down, and that's by getting vaccinated.
Coming up fast though, so when do you reckon we're going to get some answers on that? When do you reckon we're going to get some clarity and some answers around crowd numbers, given that it is coming up very soon?
Yeah, look, I'm sure that's being shared with the industry and with all of the stakeholders involved. I'm sure the consultations are happening on a daily basis. I'm not part of the public health events team, so I can't answer that question for you, but I'm sure that there's very, very significant engagement ongoing.
I've got one more from Mr. Donnellan, if that's okay.
Can I just ask
one? Yes, for the Minister.
Can I just ask one more for Ben as
well?
Go ahead.
Sorry, Ben,
Professor.
Before you go. Sorry. Of all the
Sorry,
cases
Minister.
that we've had in this recent spike, do you know how many of them have been fully vaccinated, partially vaccinated?
Yes, so if we look at... so this is for total cases, yes?
Yeah, I think we've had like 10,000 in the past week or so.
So I think that there was something in what the minister said. That was the people who were in hospital yesterday. Yeah. So it's for the people who are in hospital at the moment. Across the whole sort of outbreak that we've been seeing, you know, that Melbourne's been, or Victoria's been through, I think of all the cases, 83% were unvaccinated, 11% had had 1 dose, and 5% had had 2 doses. But if you look at people in the 40 to 49 age group, such as myself, I think 88% of people, of Victorians aged 40 to 49, 88% have had their first dose of vaccine, 68% have had their second dose, which means only 12% are unvaccinated. But if you look at people in intensive care, 93% of those aged 40 to 49 who have ended up in intensive care were unvaccinated. These vaccines work. They keep people out of hospital, they keep them out of ICU, and they stop them dying.
There's speculation about a party at Mount Hotham. Are you aware of any investigation into an event there? And
no, I'm not aware of that.
Positive cases there?
I don't have any information on that, I'm afraid.
You've not heard about that?
I've not heard anything about that.
Okay.
I'm sure it's being worked up.
Do you anticipate that fully vaccinated cricketers from England will be required to do 2 weeks quarantine when they come to Australia for the Ashes?
So if we're talking about international arrivals coming in and their sort of quarantine, there's a lot of discussions happening that again at a national and state level. I don't have any announcement on that today, but I will hand over to the Minister because I think there was some questions for the Minister. Thank you.
Mr Donnellan, I've just got a question about disability vaccination rates again. Had you raised concerns with federal authorities before now, and had we asked for any extra measures from the government before today's announcement?
Look, I've been, since December last year, have been raising issues in relation to vaccination, both the workforce and residents in residential care and broadly beyond that in terms of NDIS participants. Obviously, they were in the priority list. Somehow or other, they dropped off the priority list. I don't know what happened there. I wasn't made aware of that. Which is pretty frustrating. But we have asked for things like the worker mobility payments in terms of reducing movements between houses and alike in terms of services provided by workers. I've written, I think, 3-4 times in relation to the vaccine rollout in the disability community broadly. And that's, look, literally, that's why we've stepped in, because it's not good enough. And we're opening up. We've got to protect our most vulnerable, and that's why we've stepped in. We just, we can keep riding. That's not going to deal with the issue. We've decided we need to step up the plate. We've obviously been running priorities and programs prior to that. Today, again, is about trying to really get to those people we haven't got to make it easier to get the vaccine, because it's impossible to open up with the thought that amongst your most vulnerable people in the community haven't been vaccinated. That's just something that we can't accept.
Minister, would it be possible to ask the case studies a couple of questions?
Yes, absolutely, yes, probably. Well, do you want to do it in the sun, because it's actually, sorry, I'm not trying to tell you where you should be doing your shots, but Martin gets a bit cold in the shade, so I just thought it was probably easier to do this, finish this, and then break out, so to speak. No more? Beautiful. Okay, well then breakout time. Thank you. Oh, Sheba, better put that back on. Oh, God, I forget. Keep walking around. Can't remember whether to put it on or off and everything else. You should be wearing that